Hi guys! So we get a lot of questions here at the office about adult orthodontics and Invisalign in particular. So I thought we'd take a couple of minutes here today to review some of those most frequently asked questions. All right, the number one question we hear is, what is it? That's a great question, great place to start. All right, so Invisalign uses a series of clear trays or clear aligners to gradually move teeth where we want them to go. They are calorie-free, cholesterol-free, non-GMO, and gluten-free. And they snap on to your teeth. We replace them every 1 to 2 weeks, and they gradually move teeth where we want them to go. That's another great question. So one reason, without a doubt, is to have a straighter, more attractive smile, right? The other reason, though, is a straighter, more attractive smile is much easier to keep healthy. When our teeth are crooked, crowded, overlapped, they start creating nooks and crannies in areas where we build up a lot of plaque and germs and bacteria. So the straighter things are, the easier it is for you to keep clean at home. The more overlap we have, the more difficulty you're going to have. How is Invisalign different than traditional braces? Now, there are 3 main differences between the two systems. Number 1. It is way easier to keep your teeth and gums healthy and clean. Because you don't have bonded brackets and wires in the way that you have to floss underneath and go through all that to keep clean, you just pop your trays off, you brush, you floss normally, and you're good to go. You pop them back in. Point number 2 is that you can eat whatever you want. With traditional braces, you have all sorts of food restrictions. There's no gum chewing, there's no bagel eating, anything hard that you bite into may bust a bracket off. You don't have any of those issues with Invisalign. Now the third big deal is, clearly it looks a lot better. Invisalign, invisible aligner, right? It's nearly invisible. If someone gets really close into your face and really starts looking at your teeth, they may notice that you're wearing a tray. But in pictures, in normal day-to-day life, the only person that will know that you're wearing the trays is you. The number 1 downside, if you consider exquisite oral hygiene a downside, is that every time you take your trays off to eat something, you gotta brush and floss before putting them back in. So that means that most people end up snacking a lot less frequently than they used to before having their trays, which may be a plus. Those gummy bears just aren't worth it when you gotta brush and floss before putting your trays back in. So there is a hashtag Invisaloss out there, the infamous Invisalign 10. Most patients do lose a couple of pounds just because our dietary habits change a little bit when we introduce the Invisalign system. The other thing is you may feel a little bit of pressure, especially when we change from one tray to the next, but it is way more controlled and way less pressure than we saw with traditional brackets and wires or braces. Historically, the average Invisalign treatment was about 8 to 12 months. And with today's technology and the improvement of the Invisalign system itself, we can cut treatment time down in half. So most people are looking at around 6 months to get the straight smile that they're looking for. So how does it feel? Right? Everyone's curious to know what it feels like. Now, Invisalign uses a very, as you guys saw before, it's a very thin layer of plastic that covers your teeth. Most people tell me that after the first or second day of wearing their trays, it's like they don't even feel it anymore. Actually, so many people have mentioned that when they're not wearing their trays, their teeth feel naked, right? They almost prefer to have their trays on. It's almost like a security blanket for your teeth. Here at Semidey Dental, we offer 2 tiers of pricing depending on how long the treatment is going to take. Most cases are around $3,500, and we do have great financing options, which are, really makes it affordable for most people. This is an iTero scanner. Right? This wand here allows us to take a digital impression of your teeth. It's quite comfortable. It just kind of moves around your teeth inside your mouth. And we end up with a rendition like this, a 3D model of your teeth, where We can actually give you a simulated outcome right then and there so you can see what the expected outcome would look like. But it all starts right here. This is what I use to create a digital treatment plan for your smile.